Without further ado, let's gear up for the big picture with a keynote address. And for that, I would like to call upon Mr. Anil Matai, Director General, OPPI India. Sir, I would like to request you to come on stage. Mr. Anil Matai is a dynamic, results-driven senior executive with 30-plus experience in pharma healthcare, adept at leading multi-million-dollar businesses. He has proven expertise in strategic collaboration, business growth, and effective management across MNCs, startups, and leading Indian firms. Welcome, sir, and over to you.
It's always not so easy to begin speaking because, as Dr. Bang was speaking to me, maybe you always pick from what the previous speaker spoke and then you build on that. But I will build on my own experience in this industry over about 35 odd years, both in global MNCs as well as with Indian companies, and share some of that with you more in the context of now and next. I mean, I love that theme, which will never get outdated. It's always now and next. So it will always remain. So again, kudos to the team which coined this now and next. Having spent more than 3 decades in the industry, let me tell you what we are seeing in the recent past, especially in the last 2-3 years, is really dynamic, challenging, transformative, and we are now starting to see things happen differently because we always have been saying earlier on that think differently. I mean, I have been a man focused mostly on execution. So, and when you focus on execution, you really don't tend to think differently, that the marketer somewhere comes up with a different strategy, and then if you're focused on execution, you get on to how to get it done, when to get it done, where to get it done, and what to get out of it, because outcome is the most important. But now I play a very different role. I mean, so I will share some of what I do currently, which is more in terms of advocacy for shaping policies, dealing with government officials, which is a very different thing than what we do here in the industry, and diametrically opposite of what we do here. Every month, kitna dhanda hua? What is your top line? What is your bottom line? What is your working capital? What is your attrition rate? And everything is outcomes driven. And what I do now, outcome is inshallah. One day it will happen because you don't know the outcome of advocacy. Will the policy shape up the way you want? So it's very, very different cup of tea. So coming back to our theme of now and next, I told you that in 2024, we saw some transformation happen both in terms of way our industry performs, does business, and also at the government end. Because even at the government end, we see now an action orientation. We have been hearing all the sound bites right from the Prime Minister in terms of earlier it was, I remember several years ago, it used to be Jai Jawan, Jai Kisan. Then it became Jai Vigyan, Jai Anusandhan. And now we are talking of a Viksit Bharat 2047. And for that to happen, not only we need to make in India, we need to discover in India, we need to innovate in India. So we have seen a period. I remember when I became the CEO of Novartis about, 2003, yeah. And when we made the first global presentation to the global CEO, we had mentioned that India is now the pharmacy to the world. We are that time it was 4th largest by volume and 14th in value. So the needle has not really shifted much since then. We are almost there. We are now 3rd largest by volume. I don't know what size by value. Maybe we have consultants sitting out here who will tell us. Some people tell me 11, some people tell me 12, some 13, but I don't know where we are. But clearly we need to move to shift the needle from volume to value. And for that to happen, I mean, we have already built as a country a very strong foundation of a generic industry, a very strong foundation. And all our mindsets are all genericized. Because we really don't tend to think very innovatively. But I think a time has come now that from now onwards, it will be innovation-led companies which are going to drive growth. It is going to be companies which have started investing in research. I'm saying this will drive growth. I'm not saying that our strong foundation will go away. Our strong foundation of the generic industry will remain, and that's a strength we should retain. But on top of that, we need to build an industry which is innovation-led. Why should an Indian patient be deprived of a drug which is there globally? I mean, we have to ensure that our counterpart, an Indian citizen, a man on the street, gets that drug. And for that to happen, we need to change our mindset instead of just sell, sell, sell. I mean, this is unfortunately been a trend in the industry. We have our objectives. 20 years back, 25 years back, almost 80% sales used to happen in the last 4-5 days of the month. I don't know what the trend is now since I've been away for a couple, 2-3 years. But it's not that 80% people are falling sick at the end of the month. It's just that we have a target and we are pushing. So we now need to create a pull. We need to have approaches which are patient-centric. We have been talking of patient centricity and customer centricity for a very long time. But on ground, is it really happening? I think a time has come now that the future will necessarily, we already hear a lot about personalized medicine, and that is starting to happen. For me, 2025 will be the transformative year where there will be transformation, there will be disruption. Disruption of a magnitude which I can't define because I don't play the game of politics. I mean, the first disruption may come as early as next week when President Trump comes in. There will be a tariff war, and that can change the entire dynamics of what is going to happen. But even everything which we do, I mean, I'm sure Salil is going to speak about it, will have a key role where AI and machine learning will play a role in every step of what we do, right from drug discovery, clinical trials, marketing, sales, distribution, quality. In every aspect of our business, we will see AI play a key role. And we have already started to see early stages of that, but not so much in our industry. So in our industry, we will see AI play a key role, which will shorten the period for launch of new products, make our operations much more efficient, build in the patient into what we do, personalize the therapies which are there, which are required for the patient. So all this is going to happen in 2025. At least the beginning is going to happen, and towards the end of the year, we'll see, as I told you, turbulence happen there. And for us as a team to be ready to face that turbulence, what we need, I mean, we in India have good skill sets, talent is there, but what we need is a changed mindset. Because that's where we are more or less not stagnated, but fixed in what we want to do, how we want to do, and we really don't change, and we feel that it will not impact us so soon. But in 2025, it will impact. So what it needs is we need reskilling, we need upskilling, we need upscaling, and despite whatever age profile you are in, you have to get into it. I can't say I am 65 years old. It's not that I am 65, though I have now disclosed I am 65 years old, that I can't do it. But you have to change. You have to learn all on AI, on machine learning to whatever extent is required to do your own respective business. Because otherwise you will not be able to face this turbulence. And we need to be in a state of readiness, not in a state of readiness, but in a state of preparedness to onboard all of it. So I personally see growth coming back. You know, last couple of years we have seen growth in the industry come down. It's more been a price-led growth. Volume growths have been 1 to 2% only. But given that base, growth will come back. In my earlier days, I have seen growth of 15-18%, which is now down to 6, 7, 8, 9%. But I personally see the industry will see growth come back, led by both volume, value, and new introductions. New introductions role may still be around that 3, 4, 5%, not more than that, 2, 3%. But growth will definitely come back. So we have got bright days ahead. We have got a bright mindset in our country. The talent set is very good. But mindset needs to change around quality, change around patient centricity. Quality is another very important aspect in our business, where if I know that here they're mainly marketers, but quality plays a key role. And country as a whole got the flack about a year back when a couple of cough syrup cases happened. But that's why I said everything will be driven and facilitated by AI and machine learning. We need to work across the value chain. And I'm sure each one of you, I see a lot of bright young minds out here have got a fantastic career ahead. So I wish you good luck, and I'm sure during the course of the day, almost all these topics will get touched in one form or the other. I only touched upon the high-level points, but what to do, how to do, when to do, where to do, all that will get covered up. So we got an interesting day ahead. Good luck. Thank you very much. All the very best.
I'd like to now facilitate Mr. Anil Matai and would like to invite Dr. Ashok Bhattacharya to do the honors.